I want you to do something right now before you scroll any further. Swallow. Just once. A normal, ordinary swallow. Now tell me honestly, did you feel it? That blob of something parked right at the back of your throat that did not move? That stubborn, sticky thickness that seems to have taken up permanent residence behind your tongue like it is paying rent and refuses to leave? Now think about your morning. How many times have you cleared your throat since you woke up today? 3, 5, 15? You probably lost count because at some point you stopped counting. It has become background noise. A reflex as automatic as breathing. You do it before you answer the phone. You do it before you speak in a meeting. You do it in the car, alone, with nobody listening, for no reason at all except that something is sitting there, and your body desperately wants it gone. And the worst part? If someone asked you when this started, you would not be able to give them a date, because it did not arrive with a grand entrance. There was no dramatic moment, no infection that kicked it off, no morning where you woke up and said something is wrong. It crept in. The way fog rolls into a valley, so slowly, so gradually, that by the time you noticed it was everywhere, you could not remember what it felt like to swallow cleanly, to breathe without that thickness, to speak without that little pre-clearance ritual you do before every sentence. You have tried to fix it. Of course you have. You have gargled warm salt water until you were sick of the taste. You have sipped honey and lemon like it was prescribed medication. You have inhaled steam until your face was dripping. Someone told you it was dairy, so you gave up milk, gave up cheese, gave up yogurt, and nothing changed. Someone told you it was allergies, so you took antihistamines for a month, and your throat got drier but the mucus somehow got thicker. Someone told you to just drink more water, so you carried a bottle everywhere like a security blanket, and the mucus smiled at you and stayed exactly where it was. You have probably been to a doctor about it, maybe more than one. And what did they say? They looked in your throat for about 4 seconds, told you it looked fine, told you it was probably nothing, told you to keep drinking fluids, and sent you on your way. And you walked out of that office feeling the same mucus sitting in the same spot, with the same 0 answers you walked in with. That cycle ends right now. Because here is the thing that nobody has been direct enough to tell you. That mucus is not random. It is not a mystery. And it is absolutely not something you should just accept and live with. Your body is not producing that mucus because it is confused or malfunctioning or because something is fundamentally broken inside you. Your body is producing it because something specific is triggering it. Something identifiable. Something that has a name and a mechanism and, most importantly, a solution. Your body does not waste resources. It never has. Every single thing your body does, it does for a reason. And when it floods the back of your throat with mucus and keeps it there day after day, week after week, month after month, that is not a glitch. That is a message. Your body is trying to tell you something. It has been trying to tell you for a long time. The problem is not that your body stopped communicating. The problem is that no one has ever translated what it is saying into plain language that actually helps you. In years of working in preventive health with adults, particularly those over the age of 45 and 50, persistent throat mucus ranks as one of the top 5 complaints that walk through the door. And simultaneously, it ranks as one of the most misunderstood, most brushed off, and most poorly managed. People suffer with this for years. Years. Not because it is untreatable but because no one ever took the time to properly explain what is actually going on. Today I am going to walk you through 7 specific, clinically documented reasons why mucus sits in your throat and will not leave. Not theories. Not guesswork. Not something someone posted in a forum at 2 in the morning. These are the causes that peer-reviewed clinical research has identified again and again in adults dealing with exactly what you're dealing with right now. And I'm going to do something that almost nobody does when they discuss this topic. I'm going to show you how these causes connect to each other. Because they do not operate in isolation. They overlap. They feed into each other. They create loops, vicious cycles where one cause worsens another, which worsens the first, which worsens a third. And until you understand those connections, you will keep chasing one remedy at a time and wondering why nothing fully works. And at the very end, I am going to give you a complete, practical, step-by-step plan. Not vague suggestions. Not drink more fluids and see how it goes. Specific actions, specific timing, specific sequences, things you can begin doing tonight before you go to bed. Before we go any further, I need you to do one thing. Drop a comment right now. Just answer this question honestly. How long have you been dealing with this? Weeks? Months? Years? Type it below because I read every single comment and your answer helps me understand what you're going through. Go ahead. Now let us start where every proper explanation should start, with the basic biology. Because without understanding this foundation, nothing else I tell you today will make full sense. Your body produces mucus every second of every day. Right now, as you are listening to me speak, your body is actively manufacturing it. And that is not a problem. That is supposed to happen. In fact, a healthy human body produces somewhere between 1 and 1.5 liters of mucus every single day. That is a staggering amount. And most of the time, you never notice a single drop of it. Mucus is one of the most sophisticated defense systems your body operates. It coats the inside of your nasal passages, your sinuses, your throat, your windpipe, your bronchial tubes, all the way down into the deepest branches of your lungs. It creates a continuous wet protective barrier over some of the most vulnerable tissue in your entire body. Every breath you take, and you take somewhere around 20,000 of them every day, pulls air into your body. And that air is not clean. It carries bacteria, viruses, fungal spores, pollen, dust, pollution particles, microscopic debris from everything around you. Mucus catches all of it. It traps these invaders, neutralizes them, and prevents them from ever reaching the delicate tissue underneath. Without mucus, your airways would dry out within hours. They would crack. They would become raw, inflamed, and dangerously vulnerable to every pathogen floating in the air around you. A single day without mucus would put you at serious risk of respiratory infection. So let me be very clear about this from the outset. Mucus is not your enemy. Mucus is not the problem. Mucus is the guardian standing between you and a constant stream of threats that you cannot see. The real question, the question that actually matters, is not why is my body making mucus? The real question is why is the mucus accumulating where I can feel it instead of being quietly cleared away like it is supposed to be? And this is where things get genuinely important. Your airways, from the deepest parts of your lungs all the way up to the back of your nose, are lined with millions upon millions of microscopic hair-like structures called cilia. These cilia are not just sitting there. They beat. They pulse. They move in coordinated rhythmic waves, and their entire purpose is to push mucus upward and outward in a continuous flowing motion. Think of it as an escalator that never stops running. Mucus gets deposited on the surface, the cilia grab it, and move it along, and it eventually reaches a point where it can be quietly swallowed into your stomach, where acid destroys whatever it trapped. You never feel this happening. You never know it is going on. The whole system runs silently in the background like a well-oiled machine. But here's what the research tells us, and this is the part that directly affects you if you are over the age of 40 or 50. These cilia slow down. Their beat frequency, the speed and coordination with which they move, decreases measurably with age. Studies have documented this. The mucus conveyor belt that once operated at full speed now runs at half speed, or quarter speed. The mucus that used to be cleared from your throat in seconds can now linger for minutes, then hours. It thickens as it sits. It accumulates. It pools at the back of the throat, in the lowest point, right where gravity lets it collect. And eventually you feel it. That constant heaviness. That sensation of something sitting there that will not budge no matter how many times you clear your throat. This is not a disease. This is not a disorder. This is normal human physiology doing what it does over time. But understanding it changes everything. Because it means your body's margin for error has shrunk dramatically. The system that used to handle excess mucus effortlessly can no longer keep up with even small increases. Any factor, any condition, any trigger that causes your body to produce even a little more mucus than usual will now create a noticeable, bothersome, persistent buildup. The safety net has thinned, and that is precisely why the 7 causes I am about to walk you through affect adults in this age group so much more intensely. Every single one of them is pushing extra mucus into a system that is already running behind. Cause number 1. And I need you to listen to this one more carefully than any of the others because it is, without question, the most commonly missed diagnosis in adults with persistent unexplained throat mucus. There is an extremely high probability that it is playing a role in what you're experiencing right now, and there is an equally high probability that no one has ever mentioned it to you. It is called laryngopharyngeal reflux, sometimes referred to as silent reflux. And the word silent is the most important word in that name. Everyone knows what regular acid reflux feels like. The burning sensation behind your breastbone after a large meal. That sour acidic taste creeping up into the back of your mouth. Classic heartburn. It is obvious. It is uncomfortable. When you have it, you know you have it immediately. But there is another form of reflux, a quieter form, a more deceptive form, that operates on entirely different rules. It produces no burning in the chest, no sour taste, no sensation of acid coming up, no digestive symptoms of any kind. Zero. You could have it actively happening inside your body right now and feel absolutely nothing that would point you toward your stomach as the source of your throat problem. Here is what is actually happening. At the top of your stomach, where it meets the bottom of your esophagus, there is a muscular valve, a sphincter. Its job is elegantly simple. Let food pass down, then close shut and keep stomach acid contained below. But over time, with decades of use, this valve can weaken. Its seal becomes imperfect. And when it does, acid does not stay where it belongs. It migrates upward. In classic heartburn, it rises into the lower esophagus, and you feel the burn because those tissues register it immediately. But in laryngopharyngeal reflux, the acid travels further, much further. It climbs all the way up the esophagus, past the upper sphincter, and reaches the back of your throat, your larynx, your voice box. In some cases, it even makes contact with the tissues at the back of your nasal passages. Now here is the critical piece. Your esophagus has a thick specialized lining that can tolerate brief contact with acid. It was designed for occasional exposure, but the tissues in your throat were not built for that. They are thin. They are delicate. They are exquisitely sensitive to even trace amounts of acid. And when stomach acid touches those tissues, your body treats it like a chemical burn in progress. It responds immediately with the most powerful defense it has available. It floods the area with thick, sticky, protective mucus. It coats everything. It shields the tissue. It wraps your throat in a mucus blanket to prevent further damage. This is your body doing exactly the right thing. The biology is brilliant. The problem is that this reflux does not happen once. It happens repeatedly. And it is worst at night, when you lie flat, when gravity is no longer helping that weakened valve hold acid down, when your stomach contents have the easiest possible path upward. So picture this. You go to bed. You fall asleep. You are completely unconscious. And for hours, intermittently throughout the night, small amounts of acid creep up to the back of your throat. Each time, your body responds by producing another layer of thick protective mucus. By the time your alarm goes off in the morning, there is a substantial coating of mucus sitting at the back of your throat that built up over the course of the entire night. You open your eyes, swallow, and there it is. That familiar heaviness, that thickness you cannot explain, that blob that greets you every single morning. And because you felt no burning, no heartburn, no acid taste, you have absolutely no reason to suspect your stomach is involved. Clinical studies published in major ear, nose, and throat journals have demonstrated that up to half of all patients with laryngopharyngeal reflux experience zero traditional heartburn symptoms. None. Their only complaints are chronic throat clearing, persistent mucus, a sensation of a lump in the throat, and a voice that sounds rough, scratchy, or deeper than it used to, particularly first thing in the morning. Think about this. Does your throat feel noticeably worse when you first wake up? Is the mucus at its thickest, its heaviest before you have even gotten out of bed? Does the problem seem to ease slightly as the morning goes on once you have been upright for a while? Does it return or worsen when you lie down after a meal? When you bend forward? When you lean over? Has anyone told you recently that your voice sounds different? That it sounds rougher or deeper or tired, especially early in the day? If you're nodding right now, you may have just identified something that has been silently affecting you for months, possibly years. And here is one more detail that is critically important. If you regularly take non-steroidal anti-inflammatory medications, things like ibuprofen or naproxen, for joint pain or arthritis or headaches, published research has clearly shown that these medications weaken the protective mucosal lining inside your stomach, making acid reflux, including the silent form, significantly more likely and more aggressive. If you use these medications regularly, and your throat has been persistently bothering you, that connection needs to be on your radar. That is a direct conversation to have with your healthcare provider. We're going to come back to this with very specific practical steps. Hold on to it. Cause number 2. This is the one that hides in plain sight, sometimes for years, because it does not look the way you expect it to look. Post-nasal drip from chronic low-grade sinus inflammation. When most people think about sinus problems, they imagine the worst-case scenario. Crushing headache behind the eyes. A nose so completely blocked you cannot pull air through it at all. Face swollen, pressure pounding, misery from ear to ear. Full-blown sinusitis that puts you in bed for a week. And when they do not have that level of severity, they assume their sinuses are perfectly fine. They dismiss it entirely. They never even consider it. But here is what actually happens in a large number of adults, and research has confirmed this repeatedly. The sinuses can become mildly inflamed. Not dramatically, not painfully, just enough. Just barely enough to produce a quiet, steady excess of mucus that drips down the back of the throat in a slow, continuous stream. No headache, no facial pressure, no obvious congestion, no blocked nose that you would describe as significant, just a subtle, persistent drip that slides down behind your soft palate, coats the back of your throat, and sits there. This is post-nasal drip in its most stealthy form, and it is one of the most frequently identified causes of chronic throat mucus in adults over the age of 50. Research published in 2024 confirmed that the average age of patients presenting with chronic postnasal drip complaints is 55 years old. This is not evenly distributed across all ages. It has a direct, documented association with midlife and beyond. And here's the part where many people accidentally make the whole situation worse. They go to the pharmacy and pick up antihistamines, assuming this must be an allergy problem. And antihistamines do one thing very efficiently. They dry up secretions. They suppress mucus production. That sounds helpful, but here is what actually happens. The mucus that was thin and flowing, the mucus that at least had a chance of being moved along by your cilia, now becomes thick, paste-like, sticky. It clings to the back of your throat like glue. The underlying inflammation producing it has not been addressed at all. You have not reduced the cause. You have just changed the consistency of the result. And thick, dried, stuck mucus is often dramatically more uncomfortable and harder to clear than the thinner mucus you started with. The approach that clinical evidence supports most strongly is simple, inexpensive, and remarkably effective when done with the one ingredient that determines whether it works or not. Consistency. Nasal irrigation with warm saline solution. A 2025 clinical review confirmed that nasal saline irrigation is a safe, effective, low-cost strategy for reducing upper airway inflammation, physically flushing out accumulated inflammatory mucus, reducing swelling inside the nasal passages, and actively supporting ciliary function. It helps your cilia do the job they're struggling to do on their own. But doing it once or twice and deciding it does not work is the most common mistake people make. This is not a one-dose remedy. It is a daily practice that builds cumulative results over time. A minimum of 14 consecutive days of daily irrigation is what the evidence suggests is needed before real, noticeable, lasting improvement occurs. I will walk you through the exact method in the action plan. If this is making sense and you are connecting the dots, type the word mucus in the comments so I know you're still with me. And if you have not subscribed to this channel, please do that right now. That subscription is what allows me to keep creating content like this for you. It costs you nothing and it means everything. Cause number 3. This one genuinely shocks people because the culprit is sitting in their medicine cabinet. Something they take every single day, something their doctor prescribed, something they trust completely. There is a class of blood pressure medications called ACE inhibitors, angiotensin-converting enzyme inhibitors. They are among the most commonly prescribed medications in the world. Millions and millions of adults take them daily. They work well for blood pressure. They are important, but they carry a well-documented, class-wide side effect that affects a significant percentage of people who use them. Here is the mechanism, and it is straightforward. ACE inhibitors work by blocking a specific enzyme in the body, but in doing so, they cause a substance called bradykinin to accumulate in the tissues. Bradykinin irritates the lining of the throat, and in somewhere between 5 and 20% of people taking these medications, that accumulation produces a persistent sensation of something in the throat, chronic throat clearing that will not stop, and in many cases a dry nagging cough that lingers for months with no explanation. Now here is why this connection gets missed so frequently. This side effect does not show up on day 1. It can develop weeks or even months after you begin the medication. So if you started a blood pressure pill 9 months ago, and your throat started bothering you 5 months ago, you would almost certainly never connect those two events in your mind. They feel completely unrelated. Different body systems, different timelines, but that delayed onset pattern is precisely what the medical literature describes as typical. A large-scale study involving over 27,000 patients found that adults over the age of 65 had a 53% higher likelihood of developing this specific side effect compared to younger adults on the same medication. This is not a rare anomaly. This is a common, age-associated, well-documented reaction. If you take blood pressure medication right now and you are not sure whether it falls into the ACE inhibitor category, your pharmacist can answer that question in less than 60 seconds. It is a simple, fast question that could change your understanding of what is happening in your throat overnight. And there are alternative medication classes, particularly ARBs, angiotensin receptor blockers, that manage blood pressure equally effectively through a different mechanism that does not cause bradykinin accumulation and does not produce this throat-related side effect. That is a conversation absolutely worth having with the doctor who prescribes your medication. Do not stop any medication on your own. That is important, but bring this up at your next visit. Or call and bring it up sooner. Cause number 4. And I know this one is going to sound too simple, too basic, too obvious. You are going to think you have heard it 1,000 times and there is nothing new to learn. But I need you to stay with me here because the actual physiology behind this is far more significant